Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, November the 9th. We're honored to be here on the territories of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday, we'll be providing a written briefing with case counts and the latest information about COVID-19 in British Columbia. And then on Thursday, we'll be here in the press theater, and at that time, in addition to the regular COVID-19 briefing, Dr. Henry will be providing updated modeling and other information relevant to the COVID-19 pandemic in BC. And with that, I'm honored to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So for today, for our COVID-19 update, we are reporting on two periods from Saturday to Sunday. And in that period, we had 536 new cases of COVID-19 in BC, and from Sunday to today, an additional 462 new cases. So that is 998 new people diagnosed with COVID-19 in the last 2 days, giving our total of 18,714 people in British Columbia with COVID-19. Of the new cases, 210 are people in the Vancouver Coastal Health Region. Sorry, I think there's an error in these. Oh, no, okay. 737 are people in the Fraser Health Region. 12 are people in Vancouver Island Health. 28 are in Interior Health Region, and 11 people in the Northern Health Region. We have no new cases in people who normally reside outside of Canada. We now are up to 4,891 active cases across BC, and as you can tell, in all health authorities, of whom we now have 133 people in hospital with COVID-19, 43 of whom are in critical care or ICU. Sadly, we have an additional 5 people who have died from COVID-19 in the last 3 days, bringing our total number of people to 281 people who've died. And as always, it pains us to know that people have succumbed to COVID-19, and we send our condolences to the families of these people, to their care teams, who I know are also upset every time we lose somebody, and to our communities. We have 9,179 people across the province who are now under active public health monitoring, and 13,425 people who are now recovered from COVID-19. We've had 2 new healthcare outbreaks in the last 2 days, one at the Harrison Point Long-Term Care and one at Normanna Long-Term Care Home. And 3 outbreaks have been declared over at Fairhaven Homes Burnaby Lodge, the PICS Center, and the Gateway Assisted Living for Seniors. That leaves us with 37 active outbreaks in our healthcare system, 32 in long-term care or assisted living, and 5 in acute care. That includes 1,255 people, 715 residents who have been affected, and 535 staff. So today I want to speak a little bit about the new measures that we put in place on Saturday. From the outset of this pandemic in British Columbia, the goal of our COVID-19 response, as it is across this country, has been to maintain our capacity, ensure that we have our capacity in our healthcare system, because we know that's important for all of us, to protect those who are most vulnerable, and we know now more about who those people are, but they continue to be overwhelmingly our seniors and elders, and to keep as much going as possible in our communities. On Saturday, I put new regional orders in place for the Vancouver Coastal and Fraser Health Regions to ensure that we can continue in meeting these goals. The written orders will be available later today on my Provincial Health Officer website, and they will be in place for 2 weeks. And that is a critical time. We know that the incubation period of this virus is 2 weeks. So what we are looking at, the cases we've been seeing now, are people who were exposed 5 or 7 or 10 up to 2 weeks ago. What we need to do now is to break those chains of transmission so that in the next week and 2 weeks, we will start seeing those numbers come down, reflecting that we are no longer exposing large numbers of people. The purpose of these orders is to break those chains of transmission. And we know that those transmissions were happening at a rapid rate in some parts of our province, particularly, as we know, in the Fraser Health and Vancouver Coastal Health regions. And when we look back at the people who were becoming infected in those regions, we saw that the virus was being spread in social gatherings in people's homes, whether it was a birthday party, a dinner party, having people over for receptions after weddings, etc. We know as well that the virus was being spread in a number of workplaces, and so people were bringing the virus with them to work inadvertently and spreading it in places where they were congregating, mostly with other workers. We also know that it was indoor group physical activities that were being amplifying the virus in some cases, and this led to spread that then again went into the community. We also know that this virus was being spread when people were traveling around the province. This, of course, increases our risk, not just in those areas where we're seeing increased cases, but around the province. We know that this virus moves with people, and it is us who have the ability to stop that transmission. So, as we said on Saturday, orders are a last resort, but they are what we need to put in place right now to address those areas where we were seeing transmission happening and expanding rapidly. This latest action in our COVID-19 response is about putting the brakes on the virus, breaking those chains of transmission. It is a short-term pause on non-essential activities and travel to ensure that our essential activities like school and work and healthcare can safely continue. The focus is on reducing our social interactions and focusing on our priorities. For those regions included in the regional orders, we ask that you prioritize these critical over the optional for the next 2 weeks. So what does this mean? It's not that different from when we were addressing the issues that we were faced with in March and April of this year. There are some activities that can and must continue. We know we need to get groceries. We know we need to have our healthcare system functioning. Medical treatments and surgeries need to continue. Most businesses can and should continue to stay open with their safety measures in place. You can still go to work, but if you are able, this is a time to take a pause and consider working from home for a period of time. You can still go out for dinner, but make sure you are following all of the restaurant's rules without exception. We know that when those rules are being followed, that includes maximum of 6 people to a table, not going in and socializing, wearing masks when you're going in common areas, not having people grouping together within the restaurant. Those work when they're enforced and when people are following those rules. We know that you can still get married and have those important events like funerals, but we also know that these can be done with adequate protections in place, small numbers in places like churches, in places like at funeral homes or in cemeteries. But what we have seen, it is that it's the events after or around these important ceremonies where transmission happens, because we don't have safety protocols in our homes or in places that we go to celebrate after some of these events. So that's why, for this period of time, receptions of any kind, at home or elsewhere, are not allowed right now. We're putting a pause on those parts of this. So if you are somebody who's planning on getting married in the next few weeks, postpone that reception to a time when it is safe. And if you do have funerals or weddings, make sure that you have small numbers and that safety plans are in place. Right now, we need to reduce our social interactions and social gatherings so that our essential work and school and healthcare can continue. I am directing now that we need to think about the things that we did in the spring. Socialize virtually check in on those that you're close to. Plan parties and celebrations for next year when it is safe for us to get together again. And we will be able to get together again. We need to support our neighbors in our communities. We've seen this before. We need to start going back to that. Instead of having people over for dinner, drop off something for somebody. Check in on your elderly neighbors to make sure that they have what they need. And you can safely take things to people right now when we're all taking a step back from having our social interactions. If you are in doubt about whether to travel or whether to see somebody, right now, don't do it. This is our time to regroup. So say no to those play dates right now. This is not the time to have those social interactions. If you have visits planned from friends or family, or you're going to visit friends or family outside of the region, now's the time to postpone those. Do it at a time when it is safe. We know that when we come into an area where there's higher transmission in the community, we take on that risk and we bring it back to our communities and our families. We need now to think about adjusting our routine so that we see fewer people right now. These small steps are important for helping us break these chains of transmission. It is a short time, but in doubt, go virtual. Postpone social visits, whether it's coming or traveling. Attending medical appointments or groups or counseling, things like AA or NA, those are not social gatherings. Those are things that can continue as long as you have adequate safety protocols in place. And go outside. We've said this from the very beginning of this pandemic. Yes, it's safe to be outside. Be outside with one or two of your friends. Go for a walk. Keep your distances. But no backyard barbecues right now. Those are the types of activities that we need to suspend because we know when we get together, it's very hard to maintain those safe distances. And we are seeing that that is a situation where this virus is taking advantage and is being transmitted. So don't have your backyard barbecue. Postpone that brunch with your good friends until another time. I've been asked many questions since Saturday, and there's a number of things that we can put together on this. I've been asked things like, is it okay to have our scout troop meetings or our Girl Guide meetings? Or, these are important things. We know that these are important things for our kids. But right now, let's all be inventive and go back to the resourcefulness that we showed early on this year and do these things virtually. It's not forever, but it is for now. We also ask every business across the province, not just in the Fraser and Vancouver coastal health areas, to revisit your COVID-19 safety plans. We said this a few weeks ago, and I am reiterating. Now is the time to do everything you can to ensure you are protecting your employees and your customers. And businesses operating in Vancouver Coastal and Fraser Health, we know now we must ensure that all of your employees are doing a health check before they come into work every day. And there's many ways that you can do that by actively using apps, virtual check-ins with people. But we want to make sure that all of us are staying healthy and only going into work when we can, when we are healthy. So we can do this through an app, through online protocols, but we need to remind people to self-screen every day before we come to work. We also know that WorkSafe BC and the BC CDC and our public health inspectors across the Lower Mainland will be stepping up inspections, particularly in some of the high-risk areas like some of our food processing plants and other areas where we know that there needs to be important measures in place. But we need everybody who comes into work every day to say, yes, I did my symptom check and I am okay to be here today. And if in doubt, stay home. The other areas that we talked about on Saturday are indoor sports. For those indoor sports that are non-contact, you can continue to play these sports like curling or swimming in pools. But we need to pay additional attention to not congregating, particularly in areas on the side of the pool or before or after or in the locker room. Those are things we need to pay attention to right now because we see this virus being transmitted when we're gathering together waiting for our kids to come out of the arena. Those are the times now that we need to pay attention to. We need to think about, for those contact sports that are being played indoors, we need to go back to what we called phase 2 with the Via Sport recommendations, where we're not playing games with each other, we're not having scrimmages, we're doing drills and practices. It is incredibly important, of course, for us to continue our activities, our physical activities. We want young people in particular to get out there and to move, but we need to do it safely. And right now, with this virus being transmitted in our communities at the level it is, we have to take additional safety precautions. For outdoor sports, we can continue to play our games, but we are not traveling. There was traveling happening between regions, and right now we need to pull back and only play within our local area. And we need to again pay attention to not having spectators congregating and talking with each other and the potential for spread in those areas. Finally, I want to talk a little bit about indoor group activities, and those are, rec centers and gyms and studios that have indoor group physical activities. We have come to learn, as we do a lot about this virus, that the guidance and safety requirements that we have had in place for spin studios and yoga studios and group activities within gyms, that they are not adequate to protect us when we have this virus circulating at levels that we do in the community now in Vancouver Coastal and Fraser Health. So those are being suspended. We have a team that's working right now on developing and looking at the literature around the world. This is something that has arisen. We thought we had adequate protocols in place, and this is not a reflection on those businesses. It is a reflection that we are continuing to learn about this virus, and we now know indoor situations, particularly when we're exercising vigorously, where there's loud music playing, and spin classes are one of those situations, that is a very a situation where this virus can spread very rapidly. And we have seen that happen in studios, in dance studios, in gyms across this province, but particularly recently in the Lower Mainland. And it amplifies the virus because it can spread very quickly to 20 or 30 people who then bring it home or to their workplace, and it spreads from there. So that is why we have stopped these indoor group activities. Gyms who have one-on-one where people can go and they have adequate space and they can work with a trainer or in a 1-to-2 ratio with trainers in specific gyms, those are fine and they can continue right now. What we're talking about is those more crowded, clustering indoor settings where we have vigorous exercise, and we have now learned that that is an environment where this virus can spread quickly. So the new guidance will be coming out in the coming days and will be posted on the BC CDC website, and we will provide you with the process for having your new safety plans for those activities approved by medical health officers before you're able to reopen. I know many businesses have already reached out and are keen to get underway, but you need to hold back on those specific activities until we have the right safety measures to provide you with that advice. And we know that that means adequate space and distance and measures to ensure that we're preventing rapid spread of this virus. I recognize, of course, that taking a step back has an impact on all of us, on our mental health, our emotional health. I mean, it's challenging right now. And of course, on financial well-being for many people. With Remembrance Day coming this week, we need to look to our veterans who have shown us how important it is to persevere, that we can get through these dark times, even if there seems like there is more darkness than light. Whether, like me, you've served in the military, you have a family, a friend, or you know your community who has served before or does today. Let's honor and support our veterans everywhere by helping to keep our community strong and bend our curve. We know that veterans have sacrificed so much for us, and we are now asking for small sacrifices through this crisis too. I will also want to say that while there may be small outdoor events for many communities this year at cenotaphs, I encourage people to stay home and participate virtually, to support each other virtually on Remembrance Day. And the Legions in BC have cancelled the events that have typically taken place in order to be protective of the people that we are honoring on this day. So attend remote ceremonies, buy a virtual poppy instead. We have been through hard times before, and Remembrance Day is a time for us to remember that. Remember that we have been through these hard times, and we can and we will prevail. We can and we will overcome. And we can look ahead with optimism. If we look back to Remembrance Day and the fact that people have come through world wars that lasted for years, but that we came back as a society and were able to support each other, and we have had peace. Those are the things that we need to remember this week. We need to protect our veterans on Remembrance Day, and we need to look ahead with optimism. It may be dark now, but there is light ahead. And we will do it by going through this together, by being kind to each other, being calm, and staying safe. Thank you.
Thank you very much, Dr. Henry. I want to start by acknowledging the 5 people who have passed away over the last 2 days in BC, 3 in the Fraser Health Authority, 2 in the Vancouver Coastal Health Authority. As Dr. Henry has said, and as we've talked about, especially in the last few days, is a very, very challenging time to grieve, to come together for families, and we want all of the families to know that we are with them as they grieve their loved ones who passed away over this weekend from COVID-19. As Dr. Henry has noted, 133 people are hospitalized with COVID-19 at the moment, 43 in critical care. And I thought it would be useful to briefly review the situation with respect to hospital occupancy in BC, which is actually quite strong at the moment. People will remember, of course, that we are performing at the moment in our public health care system a record number of weekly surgeries, and have been for weeks and weeks and weeks, more than 7,000 per week over all of the last few weeks, except those with statutory holidays. And that's an extraordinary achievement for our healthcare system going on during this pandemic at the moment. Currently, there are, in terms of occupancy, in terms of vacant base beds, in other words, regular hospital beds, 391 vacant base beds and 1,894 vacant surge beds that have been added to assist us in this pandemic period. So just to put that in context by health authorities, in Fraser Health, the grand total occupancy rate is 70.6%. That means there are currently 520 vacant beds, base and surge. In Interior Health, there's 75.9% occupancy, or 355 vacant beds. In Northern Health, 67.9% occupancy, 158 vacant beds. In the Provincial Health Services Authority, 51.2% total occupancy, which is 102 vacant beds. In Vancouver Coastal Health, 65% total occupancy, including base and surge beds, 875 available beds or vacant beds. And in the Vancouver Island Health Authority, 86.9% occupancy with 175 vacant beds. To put that in the context, in critical care, there are across BC in critical care 300, both base and surge beds, 375 vacant beds, and that's 142 in Fraser Health, 38 in Interior Health, 36 in Northern Health, 21 in Provincial Health Services Authority, 98 in the Vancouver Coastal Health Authority, and 40 in the Vancouver Island Health Authority. You'll note from the presentation that was given when we presented our plan with the Premier in the beginning of September, you'll see the scenarios with respect to COVID-19 cases. You can see that while we continue to have great potential in BC in terms of dealing with more patients, nonetheless, and we're doing that in the context, unlike March and April when we are fully engaged in our surgical renewal plan. This is still a challenging situation, explains in part why Dr. Henry has taken the actions that she took on Saturday as provincial health officer. On Monday, I give an update on PPE, on the cumulative totals of PPE. You'll know that since March up to Monday, November 2nd, and last week was an extraordinary week for that, as you'll remember, we've the following PPE has arrived in BC. Just over 7,300,000 N95 or equivalent respirators, almost 124,500,000 surgical or procedure masks, almost 2,800,000 pieces of eye protection, including goggles and face shields, almost 192 million pairs of gloves, and 12,500,000 gowns. Over the past week, since November 2nd up until yesterday, a further 69,631 N95 or equivalent respirators have come to BC, 1,763,850 surgical or procedure masks, 111,000 pieces of eye protection, 30,641,000 pairs of gloves, and 629,000 gowns. Also want to briefly bring you up to date on the Health Human Resources to support our senior services strategy in BC. As you know, that involves the hiring of 7,000 people, 2,000 of them to support visitation and long-term care and assisted living, 3,000 net new healthcare support workers, and approximately 2,000 to help us deal with both vacancies and achieving our 3.36 goals by March 31st, 2021. Just to note, under the first part of that, the support for visitation and long-term care, 95% of our funding, or over $120 million, has flowed to operators already. And to date, 758 FTEs have been hired in the period with that money, with many, many more to come. I noted as of last week, we received 8,642 expressions of interest from people in BC. And half of those now have attended a callback session or a follow-up session, and more than 2,570 have gone a further step in the process and completed criminal records checks and are now ready to be matched with employers. So that work is going extremely well, and obviously we're very appreciative both to care providers, to healthcare unions, and of course the staff of the Ministry of Health and health authorities who have done an extraordinary job on that initiative. In closing, I wanted to say that there are times in a pandemic when we have to move very quickly to close the gaps and seal the cracks. And right now, especially in Vancouver Coastal Health and Fraser Health, this is that time. Our pandemic response depends on it. We know it's asking a lot of 3 million people who are served by these two health authorities, and we're making sure that every public health support we have is working right alongside. We need to make a difference now in the number of new cases as quickly as we can, and we all know why. So right now, while these new orders are not what any of us wants, not Dr. Henry, not me, not anybody, over 500 new cases a day and increasing hospitalizations is not where we want to be. It's of course concerning, and after all we've been through, we need to move fast. For the next 14 days, really, what we need to be focused on is fewer or less. Fewer of the behaviors that see the transmission of COVID-19, less opportunity for the virus to spread, less. No one says this will be easy, but right now each of us has to be taking the actions we need to take to stop the spread. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour deux périodes de référence de 24 heures chacune, soit celle des 7 et 8 novembre et celle du 8 jusqu'au 9 novembre en mi-journée. Il y a eu 5 nouveaux décès liés au COVID-19 durant ces deux périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 281 personnes décédées de COVID-19 et tous ceux qui ont perdu des êtres chers au cours de cette pandémie. À ce jour, 13 425 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablis. Pour la première période de référence qui s'étend jusqu'au 8 novembre, nous avons eu 536 nouveaux cas. Au cours des dernières 24 heures, 462 nouveaux cas se sont ajoutés. Il y a aussi, parmi l'ensemble des cas confirmés de COVID-19, 133 personnes sont actuellement hospitalisées, dont 43 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up. I would also ask that you please take your phones off mute. You will not be audible until your name is called. First question is from Claudia Van Emmerich, Global Okanagan.
Thank you so much. Dr. Henry, I just want to ask you about schools. Here in the Central Okanagan, we're seeing the list of schools and exposures growing. And if that trend continues, at what point do we decide to make any operational changes at schools? And is closing schools a possibility?
Yeah, so we know that the data has borne it out, and we'll talk a little bit more about that on Thursday. But we've seen around the world, and we've seen it here in BC. What happens in schools reflects what's happening in the community. So we have seen exposures, quite a few of them, in schools around the province, but of course particularly in the Fraser Health and Vancouver coastal areas, but also, as you know, in the interior. But we see very little transmission in schools. So that tells us that the layers that we have in place in schools are working. And that, so right now, what we need to do is focus on reducing transmission in the community to protect the important aspects of schools, and that includes in-classroom schooling.
Do you have a follow-up, Claudia?
Yes, just a quick one. If things do get so bad that we do have to transition to online learning, and I realize the Minister of Education would probably have more specific details, but do you know how prepared we are to make that switch efficiently and smoothly?
Yeah, as you say, that's a question that you can ask the Ministry of Education. I know that it is part of their planning. My perspective is the health aspects, and we know that online is a challenge for many children around this province, and that underscores the importance of in-classroom learning for children everywhere in BC. And that's why we are taking the measures that we've took in the past couple of weeks to focus on reducing our social interactions, those interactions in our community that have led to spread, so that we can protect our schools and continue to have our schools operating appropriately.
Next question is from Binder Sudjan, CTV.
Hi, Dr. Henry. Just wondering, will each of the indoor fitness facilities that have been closed, will they need to submit their own plan for approval for medical health officers? And do you think that can happen within 2 weeks, or is there a possibility that they could be closed longer?
Yeah, so that's a very good question. What we are doing, so we're talking about specific activities that we have learned allow this virus to transmit quite efficiently, and sometimes to larger groups of people. So that is things like group classes indoors with poor ventilation, often when we're exerting ourselves. And this is something that we are now seeing around the world. So we are looking at what are the important things that need to be in place that include smaller numbers, barriers, increased ventilation, modifications of practices to make it less risky. All of those things are being developed. We needed to stop those activities because we are seeing ongoing transmission. But we don't yet have all the right guidance in place yet, because we need to understand, what are the important things from the literature and from our experiences here in BC. And that work is going on right now. So when those guidance are ready, people who want to offer those types of classes again will have to have the additional protection measures in place, and they will be reviewed by our public health teams and approved before people can start up those specific activities again. So I just want to make it clear, it's not all gyms are closed. The activities that can happen in gyms that are happening with appropriate safety measures in place can continue. It's group classes with exertion where we're seeing these types of mass spread. So yes, they will be, there's a process that we're working through right now. Once the guidance is developed, we have some websites, and that will make it public where people can submit their plans, and we have a process that will review those plans before people can offer those types of activities again.
Do you have a follow-up, Binder?
Yes, and I'm just looking on the website where it talks about these regional restrictions and saying that people can gather only with their core bubble. And it says very specifically that that's the only group you can go to a restaurant with, but also mentions that other places like movie theaters are still open. So people can still do, I guess, some of those other social things for themselves, as long as there is the ability to have physical distance. I'm just trying to kind of figure out where the line in the sand is there.
So what we're telling people, this is a short-term thing where we need to stop our social interactions with people outside of our close groups. Where we are not seeing transmission is where we have adequate COVID safety plans in place. So if I and my partner want to go to see a movie and we're sitting by ourselves, we have the spacing in place, we have the appropriate things in place, those are working. Same with restaurants. We have quite strict protocols in restaurants, and since we put those in, particularly since we put in the capping of serving of alcohol at 10 o'clock and the earlier closing, those were the time periods where we were starting to see creep, where people were, not obeying the rules and wanting to socialize together. Since we have those in place, and when they are being followed, so that's on us as well as on the restaurants, that we're not seeing transmission. So we can still safely go with our close household, and the challenge is defining a household for people that live in many different situations. But the optimum is, the bottom line is, it's the small number of people that you have your own close contact with, going back to that bubble that we defined earlier on in this pandemic.
Rebecca Lawrence, Check News.
Hi, Dr. Henry. Pfizer today has announced that they're nearly ready for a vaccine, saying it's 90% success rate, and Trudeau says he's willing to welcome it into Canada when approved. Just wondering, what is your initial reaction to this seemingly great news, and what does it mean for us here in BC?
Yeah, I think it's fantastic. We've been following all of the vaccine developments really, really closely. We had some early results from the Moderna vaccine not that long ago. This is preliminary results that have been released by Pfizer, so that's the caveat. We have not yet seen the data. It has not been published publicly, but it is really positive news, and I'm quite excited about it. This trial continues. It's a phase 3 trial in humans, and there's about 44,000 people in the trial, so that's the good news. And it's being done in a number of countries where COVID has been surging. So one of the things that happens in this type of trial is some people, it's blinded, which means nobody knows who got the vaccine, who got the actual vaccine, and who got a placebo vaccine or another vaccine. So what they have said is the preliminary analysis that they've done on a subset of this shows that there's good effect from the vaccine. So that's great news. I think it's fantastic. And that means that we're on track for potentially having this vaccine available both around the world, but here in Canada and in BC in the first quarter of 2021. That's assuming everything else continues on the positive light. So that is one of the light at the end of the tunnel. The challenging thing with this vaccine is that it needs to be stored at ultra low temperature, -70. And so there's not a lot of -70 freezers that are available in our communities. And it means the logistics of getting this vaccine are going to be complicated. But we are working, the BC CDC has been working with Health Canada and the Public Health Agency and across this country to make sure we have the logistics in place to get the vaccine as soon as it's available and approved for use, as soon as the safety has been confirmed, and that we know who the vaccine is going to work best in. So those are the things that we're working on, and I'm quite excited. I think it's not going to be easy, but early in 2021, we should have vaccine to add to our tools to stop this pandemic.
Do you have a follow-up, Rebecca?
I do. Thank you so much. And Trudeau is saying it'll be available in the first 3 months. Do you think that's possible with these logistics? It sounds, -70 sounds very difficult. And is 90% good enough? Because that obviously still means 10%-ish aren't protected. What do you think about those?
You know what? When we talk about vaccines against a virus like this, 90% is really good. We know that if we get at least 50 or 60% protection, that is going to make a major difference in stopping the spread and protecting people. And that's what we need to think about first. The vaccine's going to be in limited supply. We're not going to be able to give it to everybody at once. But we can give it to people who are more likely to have severe illness and protect them. So 90% is great because we have those other measures to prevent transmission as well and to protect people. So I'm thinking, and the National Advisory Committee on Immunization put out priority groups for immunization. So if we can protect our seniors and elders in the community in long-term care, if we can protect healthcare workers so that we can prevent outbreaks in our healthcare settings and make sure that we keep our healthcare system working, those are things that we need to focus on. It's going to be challenging, but we are thinking through all of the ways of making that work.
Next question is from Lisa Cordasco, CHLY.
Thank you. Dr. Henry, people who go into people's homes to provide home care services have been asking their employer, the health authorities, to require that patients, families, and visitors should wear masks while the caregiver is in the home. And so far, the health authorities are refusing to do that. But shouldn't health authorities be making masks a requirement in order to protect their employers, and maybe they should be revisiting their COVID safety plans?
Yeah, so we know that people who provide health services in home care, they have protocols in place for protecting of healthcare workers when they go into patient homes. This is something that we've had for a long time. We do it every year for influenza, we're doing it for this. So yes, there are protocols for when masks need to be worn, but there's other things, like making sure you're dealing only with the patient and that other family members keep a distance, wear non-medical masks, are not in the room so that you don't have visitors in the room when you're in with the person. So there are protocols that are being followed by home care workers right now, and those every employer needs to have those COVID safety plans in place. And now's the time to relook at them and make sure you have the appropriate things in place.
Do you have a follow-up, Lisa?
Yes, on Vancouver Island, again, we've been lucky. We haven't had a single outbreak at any care homes or assisted living homes, and I think there was only one case of one infection ever. Will you consider expanding visits in the health authority regions where there have been few, if any, outbreaks in care homes?
So I will say I'm not sure it's luck. I think it is watching the experience that we've had around the province and the good work of Vancouver Island Health Authority staff in trying to do their best to protect our care homes and the care home staff around the province who are doing this work. And yes, we are working, as we have been, to make sure that we have all of the processes in place everywhere in the province to allow for extended and increased visits in care homes here on the island and across the province.
Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. Thank you so much for taking my question today. First off, you mentioned about the no-contact sports indoors. And where does that fall under keeping children safe in schools? Because there are plenty of kids roughhousing in gymnasiums and schools and touching each other and playing games there. So how are we going to keep them from possibly exposing each other in a gym at a school?
Yeah, so the orders do not apply to physical activities in school. We know that that's a really important part of the learning environment, and there are protocols, should be protocols in place in every school for how those activities are done safely in that school setting. We also know that it's with the cohort and with a smaller group, etc. So there are things in place in schools. It may not always be apparent to us what those are, but we know that schools have been working to make sure that physical activity in schools can be done in a safe way. I will take the opportunity to talk, though, about we need to make choices right now. During this pandemic, we need to ensure that education and our educational activities, our school activities, are prioritized for our children. We know that this is not forever, but this year, yes, it is important that children get physical exercise, or that they participate in dance classes or art classes or music, and we need to pick one of those outside of the school setting, or focus on the activities that are related to the school so that you're not exposing your family to multiple different groups. That is something that we need to do this year because of this virus, because of the pandemic. So I know that there are parents and families who want their children to be involved in many different activities. We need to scale that back this year. And we know that children are adaptable, and they can have ways of participating remotely in some other activities, but focus this year. We can't be having multiple different groups that we're exposing our families to right now. And that's because this virus is spreading in our community, and it is too risky to do that. So let's focus on keeping those essential things going that we know are important for our children, for their learning and growth and future.
Do you have a follow-up, Marcella?
I do, and I'm going to try my best to stay calm and be kind, because I spent most of my weekend trying to deal with people asking me questions about how these orders are being implemented differently in Fraser Health and Vancouver Coastal Health. So could you delve into why the disconnect with Vancouver Coastal Health and Fraser Health when it comes to the orders that were put in place on Saturday? And we're hearing one thing from one region and another from another. And it's not the first time that we've had issues with Vancouver Coastal Health not necessarily adhering to rules like everybody else in the province has been told to.
I'll start, and then the ministers can stop. And you think you had questions this weekend? I had many, many more, I am sure. And you know what? When we put in these orders, we do it with our best advice and our best intentions. And yes, many people have questions. And many people interpret very words that may mean one thing to one person, and people are, it's a shock when we put in these types of things, and it takes us some time to figure out the details, to make sure the information gets out to people in a way that they understand. And that is something that we have seen repeatedly when we've had to put in orders over time. So it's part of what I'm doing today is explaining the details. There is no difference between Vancouver Coastal and Fraser Health. There was some confusion in interpretation of some of the, particularly on social media, and it got twisted in different ways. So that's why we have a standard set of questions and answers that are out there now. It is us working together, and I've had many conversations with my colleagues in Fraser Health and in Vancouver Coastal, and we are all on the same page, and we all have the same interpretation. And the confusion that happens when we put out orders is something that we expect. But I think most people understood that that the intent of this is to reduce our social interactions and to make sure that we can continue those essential functions.
Like Dr. Henry answered some questions over the weekend on every subject, I think, from curling to every other subject that you could imagine in terms of participation on orders. And that's because in regions that have 3 million people, there's a whole variety of what people do. And there was, I think, 1 or 2 social media tweets that caused some concern, and those have been corrected, and I think everyone's on the same page, I would say. And you'll recall this, Marcella, because we've been all through this experience for 8 or 9 months, that when orders were brought in, and then in some cases when we entered phase 2 of our pandemic response back in May and June, there were lots of questions like this, and there always are when new orders come in. And I see that as a very positive thing. It shows, I think, the intention and the willingness of people to engage and to participate. And so we don't mind getting questions. I think it makes sense that we get questions. I think that the general approach is pretty clear, and I think to everyone in Vancouver Coastal Health and to Fraser Health, I would say this, that if you have a question right now for this 2 weeks, don't do what you were thinking of doing, just in general. There's an expression, I think, in one sport, in baseball, that the tie goes to the runner or something like this. In this case, I think our priority should be to stop the transmission of COVID-19. But yes, this always happens when new orders come out because they're across-the-board orders, and we have almost an infinite variety of human activity across these health authorities. But I think our teams are doing a very good job, and I just want to note this: 9,179 people under public health surveillance right now, 4,891 active cases. Over the 3 days of the weekend, 28,210 tests, record numbers of surgeries, and so on. I think, and much of this taking place in Vancouver Coastal Health and Fraser Health during a period of pandemic. I think our workers, our healthcare professionals, our public health teams, our communications teams are doing an excellent job. And I appreciate people's patience, and I appreciate their support and their interests over the last couple of days.
Next question is from Richard Zussman, Global News.
Dr. Henry, I'd like to get clarity on the restaurant situation. The head of the Restaurant Association is saying that people can go to restaurants with people outside of their family. Can you make it very clear for people who they are allowed to go to eat at a restaurant with in different circumstances?
Yeah, these are another one of the, detail things. What we are asking people is that when you socialize with your household, whatever you define that to be, your pandemic bubble. So yes, you can go to a restaurant, and I encourage people to continue to go to our restaurants that have their appropriate safety plans in place. But right now, we need to make sure that we're doing it with our group of people. It's not up to the restaurant to police this. It's up to us to police this. And that means, keeping our group small. We know there's a limit at 6 people on a table. That is in place. Don't try and go with a larger group. Don't try and mingle with groups. Now's the time where we say, we need to pull back from that. We need to support our restaurants, but doing it with our small group or going to takeout.
Richard, do you have a follow-up?
What sort of enforcement measures are going to be put in place? I know the language has been, this is about guidance, about people knowing the right thing to do. Can you speak to whether there's additional support for enforcement, how often we're going to see enforcement, and in what environments? I know you mentioned like the higher risk workplaces may see an increase in enforcement. Will we see changes in enforcement in places like restaurants or monitoring spin studios? Can you speak to that evolution?
Yeah, so what we have done is under both the Public Health Act emergency and the Emergency Programs Act, declaration of an emergency, allows us to have a broader set of people who are able to enforce orders. And that these are, some of them are orders. So yes, we have bylaw officers, we have police officers, public safety officers, we have some provincial inspectors, as well as our public health inspectors and WorkSafe BC inspectors, who are all able to enforce these orders. Depending on what they are. And yes, we will be having enhanced reviews and stepping up and enforcement if needed from public health and WorkSafe and bylaw officers for restaurants, for businesses. We want people and we need people to pay attention to these things, particularly now. We're seeing, we saw a couple of outbreaks recently, for example, in food processing plants. We know we had a whole blitz on food processing plants a few months ago because we had seen some quite large outbreaks, and now we're going back again. Some of these are higher risk workplaces where there's a lot of people together and by the nature of the work, and things slip over time. We get a little bit complacent, or people forget to check, or they don't think that they're sick anymore, or they don't pay attention to the fact that they're not feeling that well today. So we need to redouble our efforts, and particularly the focus is going to be in the Vancouver Coastal and Fraser Health region, because that's where we're seeing community spread at a higher level now. So more than ever, we need to go back to those plans that we had in place and make sure that we're doing all of them and following them meticulously.
Ashley Wadwani, Black Press.
So we've talked to people at Peace Arch Park. I know this was an area of problem in the past, but they say that they saw more than 80 tents set up over the weekend, and there's more than a dozen there today. So with people crossing back and forth. So obviously, as people aren't allowed indoors to spend time together, but outdoors is a little bit safer. But obviously, I imagine 80 tents, for example, is a problem. What is the plan for enforcement in that area? And do we happen to know at this point if we've seen any cases connected to that park?
Yeah, so I know I get people who have concerns about that park writing to me many times. As you know, that there are people who monitor that park. The border itself is a federal jurisdiction, and I know that they have enhanced patrols in that area. I'm not aware of any cases related to people meeting outdoors at that park.
Do you have a follow-up, Ashley?
Yeah, I do. And I'm sorry, this has been touched on a little bit, but I'm just hoping you can clarify once and for all here. Many people seem to be confused, for example, with why small gyms are needing to be restricted, but then spas or hairdressers and salons aren't, as an example. Can you maybe just really plain and simple explain what decisions go into deciding where we place restrictions, like what was announced over the weekend? So is it based on data from contact tracers? Is it based on other risks? Can you maybe just break it down for people to maybe understand the why as to the weekend restrictions?
Absolutely. It's based on the data that we get about where people are getting infected, where outbreaks are happening, where clusters are exploding. And we see that in specific settings. So we were seeing it, for example, you remember in the summer, we were seeing quite a lot of transmission of cases related to people going to nightclubs and some of the bars, and so we shut those down. Actually, we worked with the industry first to put in additional safety measures, and we were still seeing transmission. So we closed those facilities. That's the type of information that we use. We look at what's happening around the world as well. We've seen that in Hamilton in Ontario, there was a spin club where, again, it was transmitted to multiple places. And what we've come to recognize is that indoor spaces with poor ventilation, where people are exercising and breathing heavily, and there's somebody at the front yelling at you, and the music is loud, the virus can spread really easily that way. Which doesn't mean they're bad necessarily, but as we've seen increased transmission in the community, those become riskier. And so that's what we have found. We have had a number of occasions where people in group physical activities indoors have spread this to large numbers of other people who've taken it home, taken it to their workplaces. So those types of real world, what we're seeing, where risk is happening, has led to the orders that we've put in place. And that's why the focus this week has been on reducing the chances of transmission in those physical activity, those group physical activity indoor settings. We have early on put in place safety protocols for hair salons, for example, and they are working. We are not seeing transmission to large numbers of people or to anybody through hair salons or barber shops when those safety protocols are in place. So you will remember we have safety plans. They're on the WorkSafe BC website, for example, where people wear masks, where you reduce the number of people, so you don't come in and wait ahead of time. You don't have people going with you when you go to your hair salon. You have one person at a time. You increase the ventilation, and those are working. So when we have these safety plans in place and they're working, we don't need to take additional measures. So it is absolutely based on what we're seeing, where we're seeing people get this virus, the situations that where transmission is occurring. So I've mentioned a number of workplaces where we're seeing some of the more workplaces like retail stores, some drugstores, car dealerships. It's not the public transmitting to workers and vice versa. What we're seeing is that people are paying attention and they're following the one-way signs, and they're following the wearing the masks, and they have plexiglass and other barriers in place. It's when the workers are getting together having lunch or carpooling to work together. So now we have to pay attention to those aspects of the workplace where we're seeing risk. And it becomes more apparent and more acute when we start to have higher rates of transmission in the community, which is why the focus right now is on Fraser and Vancouver coastal health regions.
We have time for one more question this afternoon. For everyone listening today, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated information about regional orders, visit gov.bc.ca/regional restrictions. And for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Georgie Smith, CBC.
G'day, Dr. Henry. Can you please clarify where we stand in terms of the availability of flu shots? We've heard from people in various health regions that they've been told that they've run out of flu shots and won't get more until December. Can you clarify whether there is a shortage of supply, where the shortages are, and when more flu shots will be available?
Yeah, so we are not aware of a shortage of supply in the health authorities at the moment. We have over 1.5 million doses that are out there in various situations, and we know the health authority clinics continue. Where the challenge has been is that in some places, the allotment that goes to pharmacies and physicians' offices has run through, that they've used up their doses. We do have additional doses coming, and they are coming in the end of November and into December, so there is still plenty of time to get your flu shot. It's a challenging time this year. There's been an early demand for influenza vaccine, which is great. We know how important it is right now, but we are not seeing shortages yet in the province. We are watching this very carefully and across the country, and we're getting as much vaccine as we possibly can.
Georgie, do you have a follow-up?
I do. Can the orders issued on Saturday be extended past 2 weeks? What factors will you be looking at when determining whether or whether not to extend them? And how much notice can you give people living in Fraser Health and Vancouver Coastal Health if they are going to be extended past November 23rd? And of course, can we please get an answer in French?
Sure. Yeah, no, that's a really good question. When we were talking with my colleagues about what orders were needed and for how long, we want this to be a temporary thing, and we know that we can do this. We have seen that people in BC know what to do when we ask them to do it. So we are looking at one incubation period. I do not expect to see numbers start to decrease until next week if these orders are effective. Right now, the numbers that we're seeing reflect transmissions that happened a week ago, 10 days ago. So what we are watching very carefully is where we're seeing people being exposed. So that's the information that the contact tracers and the case management teams in public health get every day on every single case. So we're going to be watching where those exposure events are happening. We're going to be watching whether these orders and the restrictions that we put in place are being effective. And we would like, we expect that we'll start to see numbers coming down next week. Yes, they could be extended. They could be changed and modified depending on what we learn over the next few weeks. And we will commit to putting it out there as soon as we know what things are happening. And when we present our numbers on a daily basis, this gives us the opportunity to look at what's going on. So those are the things we'll be looking for. We'll be looking for, are there new situations that are coming up where transmission is happening? Is there things that we're missing? Are the restrictions that we put in place being effective? So that is what we'll be following very carefully. I think this time next week will be a really important time for us to understand how effective we are.
And just to say on immunization, we'll be reporting on that on Thursday, including a detailed numbers, and I think if you look back to last Thursday's report, you'll see the detailed numbers of how many doses are out this year and compared to previous years, and how many have gone forward that we've identified have been given in BC as well. It's obviously approximately 700,000 more than at this time last year are out and distributed, and several 100,000 more delivered doses provided to people. En français, je dirais que il faut que tout le monde, je pense, agisse à fond pour assurer la réussite des mesures présentées par le Dr Henry samedi. Je pense que c'est essentiel parce que en ce moment, on a à peu près 500 cas par jour dans la province, et la grande majorité de ces cas sont dans la région de santé de Fraser, la région de santé de Vancouver Coastal. Donc, il faut maintenant agir tout le monde ensemble pour assurer la réussite de ce qu'on est en train de faire. Cela étant, il est bien possible que ces ordres soient modifiés, soit une décision prise de les continuer après les 2 semaines. Mais maintenant, tout l'effort de la santé publique, du système de santé, des gens, doivent être à assurer la réussite de ce qu'on fait maintenant pour réduire le nombre de cas de COVID-19 et le niveau d'hospitalisation qui existe actuellement en Colombie-Britannique. Thank you very much, and we'll see you on Thursday, and there'll be a report tomorrow, Tuesday. Thank you.
Thanks for joining us.